Now here again you find multiple hypodense lesions in liver. This one, this one, this one. At places it feels like as if they are conglomerating. Now just see these lesions. These extend downwards. And these have involved the fundus and adjacent part of the body of the gallbladder. Gallbladder contains multiple calculi. Now, these are the metastatic lesions along the outer surface of the right lobe of liver. Now, this mass, now this again is a metastatic mass here. Now, this mass extends upwards up to the porta hepatis. Here at this level, this is the level of porta hepatis. It has involved both hepatic ducts, resulting in mild dilatations of intrahepatic biliary channels. Now this is the dilated intrahepatic biliary channel in right lobe of liver. The patient had raised alkaline phosphatase levels. Now these are the dilated intrahepatic biliary channels. These are the opacified intrahepatic branches of the portal vein, while these are, which are not opacified, which are black, these are the intrahepatic branches of the dilated biliary channels. So the patient had the blockage or obstruction at the level of the right and the left hepatic ducts. We trace it downwards. Common bile duct is of normal caliber. This is the pancreas. Now, strangely, this patient was examined by FCPS at a big institute, and they had given just normal liver, and the gallbladder was commented as contracted gallbladder, which probably contains the calculi. Although there are so many lesions in the liver and there is dilatation of intrahepatic biliary channels. Now, the most probable reason is that there was a carcinoma of the gallbladder associated with the calculi, which has invaded the adjacent liver. The other possibility could be that there was hepatocellular carcinoma, which has invaded the adjacent gallbladder here. This one, you see, this is the thickened. Let me show you in another view, maybe. Yes, this one. This is a coronal scan. This is the normal gallbladder, which contains calculi. But here you find this mass here, which is continuous with the right lobe of the liver mass, and it has surrounded this fundus of the gallbladder and the adjacent part of the body of gallbladder. So in such cases, the likelihoods are either in the presence of calculi, that it's a carcinoma of the gallbladder which has invaded liver, or if there is a element of chronic hepatic parenchymal disease and hepatic cirrhosis, then the chances could be that it is a carcinoma of the hepatocellular carcinoma which has invaded the gallbladder. But in such cases, the likelihood of the gallbladder CA, which is associated with the calculi, is more, which has invaded the adjacent liver, plus there are metastases, and there is of course hepatomegaly here. So one should be very, very careful in looking at the liver, gallbladder, thickening of the wall of gallbladder associated with the calculi, because this case was seen at quite a big institute by two radiologists. One was trainee and the other was FCPS. And none of them mentioned the dilatation of intrahepatic biliary channels, although the clinical picture was in front of them. Or these, and the patient had deranged LFTs as well. So one has to be very, very careful in looking at such cases.